Today on the Operators Podcast, we had Shananda, who works in behavioral pediatrics. We've never had someone in behavioral therapy for pediatrics before on the show, so this is a first. Hope you enjoy.
My name is Shananda, and I have been an occupational therapy assistant for about 14 years now. So I work in pediatric outpatient. So we work with kiddos primarily who are on the autism spectrum, or they could have some sensory issues. But I also wear the hat of the director of operations. And so I oversee operations both on the clinical side and then on the administrative side. So the whole scheduling, insurance companies. So I kind of wear multiple hats. It's very fun to work in this role because I get to do what I love, which is treat. And then I also get to do what I also love, which is to teach the next generation of therapists. So.
So let's kind of then look at your work history. So you were always kind of in the world of therapy. You were a therapy assistant for a while. You were in Wyoming at some point, I guess, and then you decided to move to Arizona. And then you made the move to Therapy Tree. So you started off as a clinic manager, but then you became director of operations. So how was that journey from like the manager to where you are now?
Yeah, so it was actually it was short, but it was exciting. So I came in as the clinic manager, and the clinic was having some trouble hitting billable hours, and so I just came in and really showed the team how to reinvent the schedule and piece things together. And so through that, with treatment and being boots on the ground, I'm a leader that likes to lead by example. So helping them learn that allowed me to explode the clinic. We doubled our output. And then I had talks with the regional leadership, and they asked if I would be willing then to step into the clinic director role. And so then I was overseeing the whole clinic as an assistant therapist, which is really exciting because in most leadership roles in the clinical world, assistant therapists don't always get an opportunity. So I was very excited about that, and was able then to take the clinic from being the lowest producing to the highest producing clinic in about 8 weeks. And so then I
It's
had
not a lot of
talks
time.
with,
That's pretty quick.
yeah, not very long at all. I mean, when you come in and you know the business, and I feel like your heart is in the right place, and you can get the buy-in from the people you work with. So me working with them on the floor and showing them that as the clinic director, I can also treat and do these things. I feel like it inspired them to also want to. So we worked as a unit. I always um, talk about us as a well-oiled machine. And so that's just how I operate. We operated out as a unit. And then from there, the director of operations position came open, and I was a little nervous, but was encouraged to apply. And so I've been sitting in that seat now for about 6 months. And I'm happy to say we're also turning, not just one clinic now. We have multiple clinics that are starting to turn around, and we're starting to see a real positive impact, which is cool.
Yeah. So what kind of would be the difference between a poorly run clinic and a well-run clinic in your mind?
I would say culture, right? So when you're working with therapists, and specifically pediatric therapists, we get into this because we love to help and see people achieve those goals. And so I believe that your culture has a lot to do with how well your clinic will run. People tend to want to do things versus being told to do things when there's value, support, and encouragement. I also think allowing people to be able to speak freely when there's like a new idea or a big change. Specifically, I think of we tend to change EMRs quite frequently. So when we do that, allowing people to be a part of those conversations has really helped just turn culture. Mm-hmm.
Why are you changing EMRs quite frequently? It's kind of interesting.
I guess maybe not. I shouldn't say frequently, but EMRs, there are some that you can consider like dinosaurs. They don't get updated very often, but in pediatric therapy, it changes so often. It used to be clinic based versus home based, but now you have clinics and home based in the same spaces. There's new things being offered like ABA therapy and things of that nature. So the EMRs have to encompass a lot more than just therapy. And so as you grow and the EMRs get better and better, you want to switch to make it easier on your clinicians, because the biggest drawback is our documentation, right?
Yeah.
Because those SOAP notes don't get any shorter. You have to write it the same way that we've always written it. But as EMRs get smarter, it's able to help like with predictive text, or you can have templates preloaded, which cuts down on that documentation time.
And for us at Caesar, like that's our kind of biggest pain point as well, is that there's just so many EMRs out there, and a lot of them are just dinosaurs, and you can't work with them, you can't do anything with them or develop anything for them.
No, and to get help to keep up with demand, because as insurance companies kind of influence things, treatment times adjust and things. So you're seeing more people in the same time frame. So you need to be able to work quickly and those updates done, because they just can't keep up with the demand.
Yeah. So then, what does the kind of world of insurance look like for pediatric therapy? Is it different? Like what's kind of covered? What are the insights of it?
Yeah, so it's dependent on plans. I mean, most insurance companies offer, outpatient therapy reimbursement rates. And so it gets to prove what's always been proven with CPT codes. They adjust their rates. So I would say not having a consistent reimbursement limits what you can do in a pediatric setting, because the insurance company kind of dictates what you can and cannot do at that time. Otherwise, it's a cost that's sent to the families. And in our specific demographic, we deal with a high volume of Medicaid
Hmm.
individuals. And so, as we know, those typically tend to be a lower reimburser. So it just makes things very hard to operate on those slim margins.
Mm. So then the solution is to run the clinic efficiently, I suppose. Yeah.
Exactly. So therapists are bound by this efficiency metric that most healthcare professionals, I would say, are not. And so everything we do, we have to be very, very highly efficient to provide those services to these kiddos. And I love what our company does, because we've taken a model and flipped it. So a lot of outpatient clinics see about 20% Medicaid. We see 80%. So 80% of our
Mm.
population is what I call, like they're the group of kids that really need that support. And so I'm just proud to say that we're able to help that group of children. I myself, if we get into like my personal side, was one of those kiddos, but I also have cerebral palsy. So
Hmm.
I like to, inspire people. You can be whoever, whatever, and it doesn't matter. So that's kind of our story here at Therapy Tree.
What does your typical day, like your 9 to 5, look like for you?
For me, well, I'm an early riser, so I tend to get up early and run all my KPIs, all of my metrics, expectations for clinicians and clinics, and get that information out to my team early in the day so that I can be on the floor in the clinic, helping and supporting wherever I can. I'm a director of operations that's very hands-on, so if we need to train a clinician, if we need support on the floor in OT, I will pick up a treatment. So mine's kind of fluid. I have meetings throughout my day just to discuss some things, but really I try to go in, coach, and train as many of our clinicians and administrative staff as possible so
Hmm.
we can run efficiently.
Yeah, it sounds like you're kind of running it like a startup in a way. Like if you have it, like when you're running a startup, like it's always like hands on. Like you don't just have it's like, oh, I'm a manager. I just manage and do nothing other than manage. Like everyone needs to be doing everything to make sure that the company succeeds.
Yeah, it's a team effort, really. I would say, most outpatient clinics run that way because in
Mm,
therapy it takes, 4 or 5 people to get one appointment through the door because you have your schedulers, you have your assistants, you have your therapists, and so it's a group effort. And being an operations leader and um, just wanting to be on the floor to help, I think it helps our culture as well, which drives up numbers and morale, and people want to come to work. So.
yeah. So, you know, technologically, do you use a lot of technology in the pediatric therapy space, or is it kind of more old school?
Well, there's a combination of both. So, depending on the kids, technology is a great tool. So, when COVID hit, teletherapy became very, very popular so that we could continue services to kids. And that has continued, but it's also opened the door for some new platforms for us to be able to utilize to work on things. So we do use technology quite frequently, also just to keep up with schools, right? A lot of our kiddos go to school and they're using these platforms at school. So we try to mimic that environment so that
Mm,
they can generalize that skill. And then we also have, our kiddos that have total communication needs. So we use things like augmentative communication or a PEC system, which is basically a bunch of little cards that they put on a board to talk to you, or sign language. And then in our motor, so physical therapy and OT, we use movement videos or yoga as a
mm,
visual cue for our kids. So it's a combination, but you have skills where you have to still be old school, handwriting, navigating a gym or a playground. You still have to use those tangible items to help.
hmm. I know telehealth is covered by
Mhm.
Medicaid now, but do you believe that it's probably not going to be covered, or do you think it's here to like stay? It will just always be covered.
I believe it's here to stay. Right after COVID hit, there was some talk, amongst those that decide whether or not it stays, of getting rid of it. But because we're able to reach rural areas and
Hmm.
kids and people that we haven't been able to before, I believe this is a long term solution
Hmm. What do you
and
think?
use.
Got it. What do you think is the most difficult thing about running the clinic?
I would say in the like director of operations role is
Yeah.
when you're making those big decisions that are going to impact, because when you have to do an EMR change, for example, it impacts the flow, the workflow. And when you're running efficiently, and that is one of your KPIs, that takes a huge dive. And so to get that back up, I would say is probably the hardest thing. And then, of course, with pediatrics, it's that you have also, you're treating the child, but you're also treating the family, right? Because those parents have to be bought in as well. And so teaching your team to be able to have those conversations with families and not just with the child can be one of the more challenging things.
Yeah. And you mentioned that a lot of these patients are on Medicaid, like around 80%. Like, do you think that there's a really big danger if Medicaid gets cut just to like the general population?
I'm sorry, you kind of cut out for a second.
Oh,
What was the
sorry.
last? No, it's okay.
Like, there's a lot of talk that Medicaid is kind of at risk of being
Hmm.
cut. Like, what's your kind of thoughts on if Medicaid were cut? Like, what would be the consequences of that for America?
It'd be detrimental. I mean, speaking from where I work specifically, but it would be if we cut out services like pediatric therapy, because what we know is in the first 5 years of life, there's a lot of development going on, and so many of these families that we see are in that birth to 5 year range, and so we would see a huge regression in skills in our kiddos that would be coming into school. It would put an burden on these families because therapy is expensive if you have to go private pay,
Hmm.
and they just wouldn't be able to afford things to get their kids to, you know, be able to function. And so I think it would be a very, very detrimental cut.
Yeah, I can imagine. Uh, just kind of like you mentioned that you do a lot of teletherapy. Like, how does teletherapy work in like a pediatric clinic? You know,
Uh,
it's kind of like what's the unique kind of insights into that?
yeah, so teletherapy can be interesting if they're younger, right? We need mom or dad or guardian or someone there to help ensure that they just stay focused. I would say
Yeah.
that would be the hardest part with our little guys. But because they're used to, the screen, it's easy to kind of keep their engagement. And with some of the platforms, you can give them control. And so that helps. Um, but with our motor therapists, that can be the challenging piece because you got to be able to show them what to do, and sometimes you have to have a physical prompt, and so that becomes a challenge in those teletherapy sessions.
Mm. Like, can you give me an example? Like,
Yeah, so like if you are asking a kid to cross midline, for example, so you want them to take their hand from over here and touch their toe over here, but keep their hips in a flexed position. You may have to give them a prompt to the hip and kind of rotate the hips forward. And not always is a family member or a caregiver going to be able to do something like that. Or
okay,
if
got
you're
it.
doing handwriting, right, and a kid wants to hold a pencil like this, you have to give that physical prompt for them to put their fingers right, and you might have to hold the wrist and put it in the correct position. And so in those instances, it would be a little more difficult.
Yeah, got it. Well, I don't like to keep these podcasts too long. Like, do you think there's
Yeah.
anything that we didn't cover that's worth mentioning?
Um, no, I think we covered almost everything. Just that pediatric therapy is amazing, and that the pediatric therapists in this world have hearts of gold. And yeah, pediatrics is fun. So
Yeah, I
that's
appreciate you
really all I
coming on.
got. Yeah, thank you for having me. I'm very excited. This was fun. So thank you.